Hello friends, today we talk about something very important, that is the pre-anesthetic evaluation. So this is the pre-anesthetic evaluation form of our OPD, that is the pre-anesthetic clinic, wherein we record the basic details of the patient and all the necessary history and the physical examination findings that is necessary for the posted operation. Along with the pre-anesthetic checkup form, we also provide the consent form to the patient. Okay, so these consent forms are very important because we are taking the written and the informed consent before every surgery, right? So we'll start with the pre-anesthetic evaluation, which will include the basic details of the patient. That will include the name, which will include the full name of the patient, the age, sex, diagnosis, the registration number that is mentioned on the file, and the operation proposed, and the surgery, that is the diagnosis. So this is for the basic information and the identification of the patient. Let me tell you that the pre-anesthetic medication is very important medico-legally, right? So we have to always document whatever things are there. There can be many patients with the same name, so we need to document the name, we need to confirm it with the patient, we need to confirm it with the file, and then the identification tags are also placed on the patients. So with that we can identify the name of the patient. Moving on to the history, we'll take the history, that is the present illness, the history of present illness, the past illness, wherein we usually cover the basic illnesses, which includes hypertension, thyroid, tuberculosis, diabetes mellitus, epilepsy, jaundice, etc. Moving on, if there is any past history of operations, we'll ask the patient that what is. So moving on to the next history, that is the past history, we'll ask about the past operations and what was the mode of anesthesia that was given. Moving on to the drug history, that if whether the patient is taking any drugs, and if taking, then we need to optimize it accordingly, what drugs we need to continue on the day of surgery and what drugs need to be stopped on the day of surgery. Then there is the history of allergy and history of that is the personal history. This will include the bowel and the bladder history, and if there is any personal habits of drug abuse or alcohol or tobacco or bidi smoking. Then moving on to the general physical examination. In the general physical examination, we will be inspecting and palpating and examining the basic vitals of the patient, whether the patient is conscious, oriented, assessing the GCS of the patient, and then measuring the pulse, BP, the respiratory system, and then the cardiovascular system, the CNS system for any focal neurological deficit, respiratory for any added sounds or wheeze or bilateral air entry present or not, restricted chest movements, because see, chest is very important. Respiratory and cardiopulmonary status of the patient is very important for us, especially in anesthesia. So we will be measuring it thoroughly. Then if the patient is on spontaneous adequate respiration, or what is the SPO of the patient on room air, or if he has any oxygen support. Next we'll be talking about the build of the patient, whether he is normally built or he's cachexic or obese, because obesity has also got a lot of complications in anesthesia. Or if the patient is cachexic, accordingly we will arrange the things, we will anticipate and we'll arrange the things in advance. So next will be the weight of the patient and the temperature. Then the spine of the patient, whether the intervertebral spaces are fused or the spaces are normal, if there is any specific deformity such as kyphosis or scoliosis. Then we'll do the airway examination, which will include the the teeth, that is the upper jaw and the lower jaw, the size of the central incisors, if there is any buck teeth, loose teeth, missing teeth or artificial teeth. Then the mouth opening, we'll be assessing the size of the tongue with the help of Mallam putty grading, and also if there is any specific deformity in the face, or if the neck is radiation treated, if there is restricted mouth opening, if the upper jaw is protruded and there is a receding mandible. So all these things have to be noted and have to be documented. If there is any loss of teeth or something, if there are any fixed dentures, it's okay. If the dentures are removable, then we will ask the patient to remove the dentures on the day of OT and come if we'll visually inspect the patient, if the patient has a beard, long beard, or a thick mustache, which might be a case of difficult bag mask ventilation, then we'll ask, we'll take necessary precautions. Okay, so overall we'll be doing the ASA assessment of the patient and the airway assessment of the patient. And then the basic investigations will include, depending upon the need of the patient, we will ask the investigations which will include the basic CBC, the recent hemoglobin platelet count, and the PT-INR count. Then the random blood sugar, blood urea, blood serum creatinine and serum bilirubin levels, the fresh serum electrolytes, and in some cases we also need the thyroid profile. Then we will be examining the chest x-ray in a PA view if the patient is comfortable, or in AP view depending upon the condition of the patient, and the ECG. So these things vary from patient to patient and condition to condition. Okay, it is not necessary that we will do all the investigations in all the patients. So and then overall we will be doing an ASA grading of the patient. This is a very short overview to PA basically, because people are not very aware as to what and all to do in a PA, pre-anesthetic checkup. Whatever is the history, we need to document each and everything. We need to give specific pre-anesthetic instructions, that whether they need to have adequate sleep or they need to continue specific medications, what type of cannulas are needed to be secured, what type of catheters have to be needed in hand before taking the patient to OT. And after all this, there is obviously one column of informed consent. If you can see, this is a column of informed consent, जिसमें हम patient और उनके attenders के signatures लेते हैं, उनको explain करते हैं पूरा risk and the basic risks which is involved in the procedure and the associated risk factors. We'll also get the sign on the written consent form, so that will include all the details, that whatever risks can be encountered while we are giving anesthesia.